rapid, fairly rapid advancement in consumer representative work. So I started off about 4 years ago. I was actually very kindly invited to come along to a co-design session for a youth mental health service by one of the clinicians I was working with. Was very, very excited by that, started looking for lots and lots of different opportunities. But at that stage, it was still mostly focus group participation or kind of just coming along and giving feedback on resources. So I just kind of kept at that for a few years, and now I'm in a much kind of more developed stage in my consumer journey. I do a lot more high level committees. I'm the Queensland representative for the National Mental Health Consumer Carer Forum, and I do a lot more work with I guess at the policy level than at the resource and system design and actual service delivery level. So I guess we're going to kind of explore in today's session what that kind of journey can look like, how you get started, when to know when you're ready to get started in it, and also when to actually decide if you need to take a break. I've done that multiple times over the last 4 years, and that's completely fine. And we've all been there at some stage or another. And also, I guess, how to take your engagement from, just taking opportunities to really, really digging into the stuff that you love doing. So thank you again for having me. You're on mute, Rima.
You know, such an amateur, aren't I? I do this weekly and I'm still talking on mute. So for those who have joined us for the first time, the session will run for an hour. If you can please keep yourself on mute, have your videos on. It's really lovely to see you. If you can, we will do our best to take questions throughout the session if possible. Otherwise, we'll hopefully have time at the end as well. And then may I please respectfully ask your permission if conversations start veering off, that I could interrupt you and bring us back on track. So if you can just give me a bit of a show of hands, if that's okay with you. Yeah, thank you very much, everyone. All right, okay. So Jelly, can you see my lovely slide that says HCQ warm welcome? Awesome. And everybody has received a link for the slide deck, or do you need me to repaste that again? I might just do that one more time. There it is. Okay. All right, so we're just going to do a little bit of a quick review of what we have covered so far. And maybe we just start from the very first session of what it means to be a user of the health system. And so you're a consumer or a patient. And so you're receiving care, and then you step into the space of influencing care, which is when you're stepping into the role of a consumer representative. Everyone okay with that? I really love that distinction and about receiving care and influencing care. So really remember that. And I think that's a really nice way to explain it to staff sometimes too. I was working with a health staff member last week, and they couldn't understand why consumers could not be involved at a governance level. And that was a really interesting discussion to have with them, because consumers can be involved at any level in an organization, right from the top all the way through to service delivery and anywhere in the middle. And as you saw, we discussed that there's lots and lots of health organizations you can get involved in as well. Yeah. And moving on to the next slide. Before I go on, I might just check in with Jordan. Did you want to add anything more to that slide?
The concept of, I guess, the difference between receiving services, influencing services, and that change. Only that it can be a bit of a tricky transition to get your head around at first. Understanding what exactly a committee or a service or an organization expects from you in that role can be quite challenging. And also, understanding what the actual purpose of the project that you're engaging with is. Sometimes it's really helpful to give broader feedback about, this is a really common issue in the sector or something like that. But sometimes all they really need from you is just to understand if the language they're using is comprehensible, if what they're saying is appropriate kind of terminology for a particular condition. So just don't be afraid to ask questions. It might be a bit confusing at first, but you really do get your head around it as long as you've got some people around you who can give you some good answers.
Awesome. Thank you, Jordan. So this concept of consumer partnerships is deeply rooted in social justice, and it's based on the fact that if people are being affected by some decision-making process, then they have a right to be part of that discussion and that decision-making process. So what I want to acknowledge here is that each one of you wants to do this work because you want to make a difference, right? Is that right? Lots of nods. Yes, you want to make a difference. So maybe something happened that didn't go so well, or maybe something went really well, or that you retired and you have lots of spare time and you just want to give. So whichever angle it's happening for you, I think it's really important to acknowledge that it takes a really committed and motivated person to want to do this work and to support the work in systems improvement that's happening all across health. And the work that you would do not only would benefit you in or the immediate group that you're working with, but it impacts health in the future as well. The consumer, Beck Mwanga, who is our CAG chair, who co-delivers the fundamental session, she once said that for her to be involved in maternity work as a consumer rep was really important because she knew that her work would impact her daughter. Because when her daughter was accessing maternity care, what Beck had done now, because change sometimes takes a while, but we hope that way before that change happens, that her daughter would benefit from what she does. So here I just want to say thank you. Thank you for what you do. Because it's, I said this a couple of sessions ago as well, that it's hard work and it's heart work. It's work that comes from here. Yeah. Jordan, jump in anytime you want to add. If I see you unmute, I'll just become quiet. Okay. So this is the Charter of Healthcare Rights. We talked about this last week. I want to draw your attention to this last point here. So giving feedback. So this is the point in the charter which gives you not a clue, but like this, you know, with flashing lights that you have a right to contribute to this systems change and to even be involved in any kind of care that you're receiving. Yeah, so remember that, and this is a really wonderful resource for you to access and use in the way that you give feedback as well.
This is also not the only resource, and I'm sure you know, we talked very briefly about the standards in the first one, which you don't need to go and research all the details of right now because it is a lot of policy documents, but there are so many resources, so much legislation that does actually support consumer involvement. And this is a really handy thing if you actually haven't been presented originally with an opportunity to provide feedback on something and you really, really want to, or you've had a specific experience, you can actually go to the health service and say, hey, you know, I feel like I wasn't given an appropriate avenue to provide this feedback, and I'd really like to provide this feedback, and this is the way in which I feel validated to do so. Could you, you know, please provide an avenue for me to do this? And I think that's actually something that comes up quite a bit in consumer work, is that a lot of it's applying to roles that are advertised through Health Consumers Queensland or other things, but you can actually go ahead and make your own opportunities to make change for a particular service, especially if you feel like that option hasn't been provided to yourself or your peers who also access that service. So yeah, don't be afraid to just walk in a door with this piece of paper and say, hey, you know, I'm actually entitled to do this, so please let me do it.
And you'd be surprised, sometimes staff are like desperately looking for consumers. They often say that we can't find good consumers, or consumers, you know, from different experiences and backgrounds. So the more people that, you know, reach out and say, hey, I'm interested. And I think most of the hospital and health services have some sort of landing page on their website that says, do you want to engage, or do you want to contribute or volunteer? There's like lots of different avenues, so you can have a look at that. Okay. So I think that what we might do over here is I will go through these points, and then Jordan, you might want to just, when I finish each one, just elaborate on them. So like Jordan said earlier in this, when she was doing her introduction, that she actually was invited to start doing this work. It wasn't something she thought, oh, I want to do this. An invitation came because of whatever was happening. So you can expand on that. But the point of it, so for her, it just sort of morphed into that space. But all of you are here because you intentionally are thinking about this and you want to do this work. So the important thing here I'd like to encourage you to do is to think about your why. Why is it that you want to do this work? What is your passion around this? What fuels it? What infuriates it? What inspires you? Think about your why. And one of the reasons why I say that it's a really important thing to do is to think about your why is, and we've said this many times, is that consumer work is slow work and sometimes it can be frustrating. So revisiting that why will affirm why you're there and will give you inspiration to continue on the days that it feels really cloudy and gloomy and you feel like nobody's listening. Yeah. Do you want to add to that, Jordan?
I was actually reminded of another thing that Beck shared with the community advisory group one time. I think this was Beck's strategy, was at the end of a year, she'd actually write down why she was doing something, look at all the committees and activities she was participating in, and then really step back and think, are these the kinds of things that align with why I'm doing this? And that is such an important strategy. If you're really putting yourself out there and you're taking a lot of opportunities, actually, stepping back a little bit and thinking, hey, am I burning myself out here? Am I doing a lot of stuff that I'm not really invested in? Re-articulating your passion for consumer work is so important. And I think that's something that, it develops and changes a lot over time. So when I first started doing consumer work, I had no idea that youth consumers in particular were very, very difficult to engage. And so suddenly I was getting all of these jobs and opportunities and roles for, we'd love a youth consumer to come along to this, or we want you to be on this committee because we don't have any young people there. And I thought to myself, I was like, I never really cared about youth health. Quite frankly, I was a young person who accessed health services, but I never really thought about the specific and unique challenges that people in my age bracket actually experience. We're a lot more vulnerable, we're a lot less financially solvent, have a lot less health literacy and ability to navigate the health system. So my why changed a lot over time. I went from being, I really feel like my specific concerns, about my treatment and the treatment of my peers, I feel like the system isn't appropriate for that. And then over time, it kind of grew and became something a bit broader, a bit more, representative of my whole population. I was much more passionate about even non-health topics like involving young people in politics, improving youth financial literacy, all of these kinds of things. So it's fine if your why changes, but it's really good to come back and check in and see what exactly it is that year.
Wonderful, thank you. So if you are in this space and there's opportunity to have momentum, but there's also potential that things can get harder. So this reflective activity that Jordan just shared with you, which she had another really experienced consumer share with her group that she was part of, is annually reevaluating where you're at and is it serving you. So it is around understanding your limits and knowing what you can influence and what you cannot influence, and knowing when to say no, because you start doing this work and you do a really good job at it, and then everybody wants a piece of you. And there are so many opportunities and they all look really exciting, but each one of us is journeying, has a health journey as well. So you got to assess where you are in your health journey and where you're at, how well you are, how much you can do. And sometimes you just have to say no. So knowing that and understanding your limits is really important. And to also maybe just say to you that there will be lots of opportunities along the way. So if you say no to something now, don't feel like that something won't come up again. You can even express to that a hospital health service that I am interested in this, but not right now. Can you come back to me so that maybe they can keep your details on record? So there's ways of staying connected as well. Know what you want to achieve. So consumer rep work is not all about just you giving. There has to be an exchange. So what is it that you want to learn? What is it that you want to make a difference in? And be really clear about it and have a discussion about it with the health staff that is supporting you in your consumer work, because I think it's really important for them to know that you have goals in your consumer rep work as well. And for a lot of hospital and health services, staff have access to training. Most consumers can access that too. It's just a matter of the staff finding a free computer, which there are a lot of at the moment, because a lot of people are working from home. And so you might have the opportunity to just be there and just go through some training. It might be how to use Word, how to use Excel. If you have a finance background and you're looking at budgets and things, maybe it's around effective communication. I mean, the options and opportunities there are endless. So always ask, yeah, very important. So the other thing to think about is being there for the right reasons, yeah. And who is it right for? So is it right for you, your partner, the person you're caring for? So spend time and reflect and become really clear about where all of this fits in and your reasons for being there. If your reason for being there is about navigating your own health journey and then finding better access to different care, then it might become a little bit challenging, because then what we often have observed is your own storytelling and sharing brings up emotions and things which are not processed or not in a space where you're able to move through them and use the experience to give advice on improving something. So becoming really clear and aware of that. There is no doubt, though, when you do consumer rep work, and Jordan would agree with this, is that you become really good at navigating the health system. And you, in fact, become a resource not only to your own health system navigation, but to people around you as well. But certainly, yes, being really clear about that is really important as well. And then get really comfortable about questioning things. So if there is one thing that you walk away from today's session, and if that one is ask questions, we've done a good job. Because even if you don't know the answer to something, if you just ask a question and got people at the table thinking about the consumer voices that are not present at a particular discussion, or a consumer perspective that has not even occurred to the group of people who are working on a project, then you've done a great job. Yeah. All good, Jordan? Anything to add?
You can always talk about these points over and over and over again. But I am happy to chat with people afterwards if you want some specific anecdotes or examples of what you can do to help navigate that. I guess my only real point, and Rima has articulated this very well already, is time is a really big factor in it, not only in terms of the change that you want to achieve, but also in your own skill set, recognizing when maybe something's not a right fit, or understanding if particular topics are a bit difficult to talk to at a certain stage in your journey, but also recognizing when you're ready to jump back in and start talking about that. So it took me, I think, even 2 or 3 years before I was really confident in sharing particular parts or working on specific projects. And now I'm feeling a lot better about it, and glad that I waited that time to actually start doing those particular pieces of work.
So now we're going to do a little bit, I think Jordan has done some of it, but we'll go a little bit deeper in it. And we want to do this activity as a way to illustrate for you to do this on your own, or if you find a buddy. So you might have exchanged phone numbers with someone here. There's like a group of young people from the sunny coast. You could all go for lunch or something and then do this as an activity together. I think that it's really important to know some of this and write it down maybe even, and journal it a little bit and maybe decorate it and stick it up somewhere, so every time you walk past, you remember it. So Jordan, do you want to just see these questions, and if there's any nuggets from there that you can pull out from the consumer journey you've had, it would be really wonderful to hear it. So in particular, you've shared about your why, you can go in a little bit more, but I want to also hear a little bit about what inspires you, because you do so much, and you also are studying, and you also work and do consumer rep work. So how do you manage all of that, and what inspires you to keep going? And maybe also share the particular areas that you're passionate about in the work that you do. So you're choosing specific areas to work in.
Yeah, first of all, on the point of choosing about what areas to work in, I only really had the, I guess, privilege to do that after I'd developed enough skills that I felt confident that I could make those kinds of selections. So definitely at the beginning, it was a matter of basically, just throwing myself at the wall and seeing what sticks. It's probably a better metaphor for that, but you know what I mean. And but once I'd kind of gone through that initially feeling messy bit of just figuring out how to do the job, what I really enjoyed, what I really stuck with and got something back out of, that's when I was able to kind of look around. And through that process of actually figuring out what, basically just taking every opportunity available, that is when I kind of figured out and articulated much better what I was passionate about. I think without that whole process, I wouldn't have necessarily known. I would have thought, oh, I care about mental health because I had, these experiences when I was younger, or I care about, health literacy because a lot of my friends aren't very health literate. But the broader stuff of, actually, I care about, seclusion and restraint. It's not something that personally affected me, but it is something that's really important to a lot of these other things that I can see happening. And getting that kind of perspective, I think, was really important for understanding what I really cared about. In terms of, all of this stuff, like balancing, working in the health sector, studying, all of that kind of stuff, something that really helps is the fact that it is also very connected. Getting to work with people every day who are accessing a really broad variety of health services helps to contextualize sometimes some of the things that you hear about on like an academic level, or maybe you're working with a service that goes, oh, we're kind of pushing this initiative through, and then all of a sudden you're with a person who's actually accessing that, and seeing what it's like from their perspective is really reinvigorating, because you can remember like really clearly what it was like to be in their shoes as well. So constantly keeping that connection with my community and supporting people through that and really being alongside them. And I'm sure that there's a number of carers in this session today who can really relate to that experience as well. And then also, the study part of it, feeling like I'm actually continuously learning and developing my skills, feeling more confident every few months in the actual content that I can engage with, feeling like I'm able to work on those higher level committees. I recently had, for the question, I'm studying public health. So it is really all, I'm very much a one track kind of mind. Everything is all very, very aligned. Just to answer that little question.
Jordan,
yes.
Were you studying public health before you started doing consumer rep work? Or
No, I was not. I had originally signed up for an arts degree, and it just wasn't a good time for it. So I dropped out. And then I just took a couple of years to do something else, just anything else really. And like I said earlier, there have been times where I have taken fairly extended breaks from working with healthcare at all, just as part of that whole, just finding the right time for it and understanding that, sometimes I'm just not really at a point where I can be doing those kinds of high level committees or any engagement at all sometimes. But then I had the pleasure of working for a PHN for a while, really getting back into consumer representative work, finding that I was at a much better place in my life to be regularly engaging and committing to that kind of role. And then that's when I decided, I really want to take this to the next level and actually study this. And so I recently had this very interesting experience of being involved in an APRA community review group of a plastic surgery, I think, cosmetic surgery specifically. You might have seen some of this in the news in the last couple of months, while also studying APRA regulation and registration at the same time in my degree, and feeling that synthesis of those topics was really, really amazing. But I also want to acknowledge that's not necessarily an option for everybody. It can be really, really challenging sometimes, feeling like you don't necessarily have a lot of other things going on in your life outside of the health system, especially if you've got a lot of personal caring responsibilities or really having to take care of your own healthcare. And that's usually when I'll try and find something a little bit different, just try a hobby, something, really reconnect with my friends, take that time to really re-engage with the other parts of me. And then in terms of, what can keep you going in the long term? I mean, obviously I've set up a lot of different things, but I actually find for a lot of representatives, professional development opportunities like conferences, forums, when you're actually in this really kind of high energy space with a lot of other people who do your work or are interested in your work or who care about the same issues that you do, can be really reinvigorating. I think I mentioned earlier, and it's been addressed in some of these sessions, is it is a bit of a lonely job sometimes. Like often you're the only consumer representative on a committee, or you don't really have a lot of your friends or family members who understand the work that you do. So actually being in a space where you're able to make those instant connections with people can be really revitalizing. And then you can go back and you can think, oh, okay, so I learned this, I learned that. I feel confident and empowered to bring these learnings to the actual work that I'm doing, or reevaluate the type of work that I want to do.
Thank you, Jordan. Oh, Breanna's got her hand up. Hi, Breanna.
Hi. I just wanted to say as well, like I think Jordan is so right when she says that going to forums and professional development really inspires you, because I find the same thing. I went recently to a Senate for the Queensland Child and Youth Clinical Network. And I walked away from it, and it was a full day, and I walked away from it just like so inspired to keep going. And I don't know, just I found a new light kind of thing. And especially because I know about you, Jordan, but I started my consumer rep work in COVID. So everything was online, and it was quite it was really great, and it was really interesting, but it was quite isolating, because you did often feel like you were by yourself. But when all of the forums and events started coming back up again, definitely found that every time I went to those, I was even more inspired. So if you have the opportunity to attend them, definitely worth it.
And you can ask a health service to sponsor you to go. That's something that a lot of people don't know they can do, but you can just ask. If there's something that you're really excited about, Health Consumers Queensland's annual forum, or other events, then yeah, a health organization can sponsor you, and there's ways to ask for, like, how to draft that email, how do you ask the question. It can feel a bit intimidating, but a lot of organizations actually have specific budget to support the development of the lived experience workforce. So don't be afraid to ask.
Awesome, thank you, Jason. There isn't any other mic on. Can you hear okay now? It could have been me, but it's pretty quiet my end. Is it clear now? Can I just see a thumbs up? Okay, awesome. Thank you. All right, so thank you, Jordan, and also Breanna. So this activity that we've just done now, this is like a really wonderful thing to do as a group or with somebody else. There's a bit of a tip there on page 17 of the consumer guide. There is a list of 10 questions, and they're really good to just work your way through. And a good list of questions to go through on an annual basis or a 6-monthly basis to reevaluate where you're at. I mean, even if you're in a job, there's annual evaluations of your job, right? You sit down with your manager and do it. So why not with your consumer rep work? Yeah. Okay. Right. So ways to partner with health organizations. I'm sorry, the text is a little bit small, but there are so many ways. So many ways. One of the most favorite ways for health organizations to interact and involve consumers, partner with consumers, is to pop them onto a group, a consumer advisory group, a youth advisory group, a community advisory group. So you will hear acronyms like a CAG, a CAC, a YAG. There's all jellies nodding their head. There's so many of them. And they are set up because there's like a working group. So there'll be some professionals, hopefully 2 consumers, which is what we recommend, and then a few external stakeholders. So it's about bringing a group of people together, and it's a way that in health people are really used to working. So when we are running these staff training programs, we say to staff that meetings and doing things the way you do in consumer advisory groups and setting up meetings face-to-face or online is something you do regularly, and it's normal for you, but it may not be normal for consumers and their regular thing. Maybe some of you previously had professional lives where you used to these sort of structures and ways of working. And if you do, then awesome, then you're used to it. But there's jargon even in meetings, you know, there's minutes and moving minutes and approving minutes and moving motions and noting down different conflicts of interest. So there's all sorts of things even linked to a meeting. So it is one of the ways they love working, but it is not the only way. In our staff guide and consumer guide, there's extensive notes around this. So I encourage you to read it. But moving on, let's go through some of them. And Jordan, if you have examples of any of these, jump in. So giving feedback. So let me ask a question to you all. If you're involved with a health organization and they send you a brochure or ask you to review a website, what is one of the first things you will think about that I have been saying about involving consumers? Should they have put a brochure in your hand, or should they have originally asked, what would be the best way to communicate with you? Because not so. Here, what I'm trying to guide you to come to think about is when health organizations partner with consumers, they need to do that from the beginning. So if somebody has the brilliant idea that they want to create a brochure for post-surgery for pediatric cardiology, how the mothers or fathers need to care for their children after surgery, they need to actually ask the parents, would a brochure be useful? Or would an app be useful? Or would you prefer to just watch a quick video? Do you see the difference? That what I'm trying to point out? So that's one very important thing you can immediately say, were consumers involved in developing this brochure? Because it doesn't have to be that the same consumers are involved throughout the whole process. There's benefits in doing that, but different consumers can be involved at different times. So you can give feedback about brochures, websites, policy documents that consumers might need to see, or they might ask you to input about a new policy that they're developing. And this is not everybody's piece of cake. For people who are studying public health, this would be like a thing they would love to do, right, Jordan?
It's basically recreational at this stage.
Very heavy reading, but you know, some people like doing that. So there are some things you can do. Another really interesting thing to think about is sometimes focus groups happen or community consultations happen. So you might even see Brisbane City Council doing this. They want to change something in a park or something, and they will call a town hall meeting or something. So like I said, consumer partnerships doesn't just happen in health. It's all across the sector. So you can pick. So after doing our training, if you decide to go elsewhere, that's okay too, because you're making a difference somewhere else for somebody else. So a focus group would be a one-off thing. Yeah. Giving feedback about a brochure or website is a one-off thing, not ongoing. Sitting on a consumer advisory group or a YAG, youth advisory group, could be an ongoing thing. So your terms of reference might say it's your position or your role is for 2 years or 3 years, and there might be a review in there. So there's a difference in the level of involvement you have. With me so far, everyone? Yep, okay, good. You can give feedback in forms and surveys. They're really quick also. Who over here has been a kitchen table host? Nobody in the session today? Okay. So a kitchen table host is a really excellent community engagement methodology where one of you, any one of you, and if you're interested in doing this work, Anne Curtis in our organization is our engagement consultant who does this work. And it's a really fantastic way to hear the voices of people who, from a really grassroots level, so you would be collating together. So you'll be trained how to do it, and then you would run it and then collate the information and bring it to Anne, who will pull it all together and pass it on to Queensland Health or whoever has asked her to do it. We even did one for Southeast Queensland CQEP. What does that stand for, guys? It's something to do with water. CQEP. Anyway, this was around recycled water. So we did consultation on that, and we did kitchen tables on that. So it's a really awesome methodology. So if you're interested in it, let us know. You're most welcome to get involved in that. Oh, Tao has. Wonderful. Yes. Yes. You can get involved in research. So if any one of you are interested in research, there's a big push now in involving consumers in being more than just participants of a study. So not, I mean, the image that it paints in my head is someone's got lots of things on their head or they're being poked and prod as participants, but you might be asked to answer questionnaires or things, but that's you participating in the study. What we're talking about is partnering in the research project as a consumer research partner. Yeah. So your name actually goes, so it might be published in a medical journal somewhere, and it would say J. Firth, you know, consumer researcher, alongside all of the other health professionals who participated in that study or who actually developed and ran that study. So that's another really interesting area. Training and orientation. So, you know, Jordan's involved in training right now. You can also become involved in orienting other consumers and staff in their orientation. Recruitment. Consumers get involved in recruiting new staff. What else? So period. Go ahead.
Sorry. Selection panels are also a growing one, not so much in you know, hospital and health services, but in the primary healthcare networks, when they're commissioning a service, so giving them a lot of money basically to run a service in their area, actually getting consumers on the selection panel so that it's kind of aligned with you know, what the actual population would like. We've had this issue historically of you know, some services thinking, oh, we know exactly what this population really needs, and we're just going to fund these guys to deliver that service and it's all going to be fine. But there's a growing movement to get consumers actually involved on selection panels, and then deciding where that money goes, evaluating if it's being spent wisely and if it's actually meeting the needs of the population. So I'd strongly recommend it for anyone who wants to get into the primary care space.
Awesome. Actually go back one. So basically, the point of this slide is to say the opportunities are endless. Say no and yes to any of these as it works for you. As Jordan said, sometimes Rachel will take that question shortly. So where was I? Say yes or no to opportunities as they come for you based on where you are in your consumer journey. Yeah. Choose how you engage with the health system. You are actually in charge of this process, and there are more formal ways. Some of the ones we've listed right now are formal ways, and then there are informal ways as well. There are many ways. So think about what would work for you and help you in this space. Yeah. Go to the next one. So some of these we've covered, but let's just go over this. That when you step into this work, you need to be ready. And this I'm referring to as your state of mind. If you're still really upset about your health story and and it triggers a lot of strong emotions for you, then maybe think about delaying doing some consumer rep work until your grievance is a little bit more resolved, so that you can speak about it without a lot of emotion coming up. Because when emotions come up, our ability to think clearly and give really clear or even have clear conversations becomes difficult. Am I right? Yeah. When we're emotional, it's hard. So it's the same in consumer rep work. If in your health journey something happened that is still coming up strongly, then maybe working on resolving that or finding peace with it before you step into roles. In saying this, it doesn't mean that you can't. It's about thinking about what support networks you put in place that you can utilize and access when things come up for you. So sometimes you might feel like, yep, I'm all good, I can do it. And then all of a sudden something happens and something comes up really strongly for you. So I think it's really important to have people and mentors in your community, other consumers who you're working alongside. I think the youth advisory group in Sunny Coast is really lucky. You've got a big group and you've got each other. So fostering that connection and mentoring each other and being there for each other is a really powerful way to move through it together. You know, the synergy of your learnings actually makes all of you grow together, and the synergy of your support strengthens you as a group. So think about what support networks you have in place to allow you to move through this, and be realistic. Not everything can be changed by you. You know, we just pick at little bits and then everybody else is doing it, and together a change happens over time. What else can I say to you? Jordan, actually there's a couple of questions here. There's 2 more slides. I'm going to go through that and then let's open up for questions. So I think we've talked about this. Consumer work takes a lot of time. It's relationships-based work. And also recognize and acknowledge that there is a power imbalance in the health system. And Jordan, it'd be really great if you talked a little bit about that when I stop talking. And recognize that there is that power imbalance, and Jordan will expand on that. Again, the relationships part, you know, when emotions do come up, all of those really amazing communication skills we talk about in any relationship come into play. Yeah, keeping frustrations in control, dealing with the problem rather than the people, and spending a lot of time listening. Being a good listener and then asking questions after you've listened is a really, really powerful way. Okay, I'm going to stop screen sharing now. Jordan, over to you. And then there's a couple of questions in the chat thread too, if we want to look at that together as well.
Okay, so a lot to talk about, mostly with, so first of all, with the power imbalance thing, first of all, when you're starting off as a representative, there's an inherent power imbalance of knowledge and lack of relationships, even simple things like understanding how to travel from your location to an office if you need to have it there, how to navigate Zoom and Teams. That actually takes a bit of time to figure it out. You know, literacy levels, all of that kind of stuff can feel like a pretty strong imbalance to begin with. Then there's an additional, I guess, imbalance between the fact that traditionally doctors have had power over patients, changing that balance from actually you're not just a treating professional and I'm just the person that you treat and you know everything about my care and my well-being, to we're actually partners in my health journey and your career, understanding that we both really have valid insights to put into a piece of work, and that we need to work together collaboratively and not emphasize one perspective over the other is really important. And then again, as well, if you do happen to come from a marginalized community or you've experienced you know, really negative interactions with the health system over your life, that can be quite challenging as well when you're suddenly in a space where you may feel unsafe or you're not very represented in the room. Breanna and I definitely have both had this experience of being the only person under the age of 45 on a committee before. That's always a little bit strange. And I'm sure that the emergence of things like youth reference groups or Aboriginal and Torres Strait Islander yarning circles do help to create a safe beginning environment sometimes, but occasionally you will be thrown in the deep end and you may not feel comfortable, but just developing that confidence to let someone know if you feel like an environment's not appropriately accommodating for you. I think that's actually a fairly good segue to one of the questions, which is about having health issues and participating and what accommodations can be provided to participate. So that was from EJ. Yeah, that's a really good point, EJ, and it's something that does actually come up a lot because everyone obviously has different accessibility needs and understanding, that in a lot of cases, I would say the majority of cases, the onus is actually on the organization engaging you to provide those accommodations. So some things like, let's say if you go through an expression of interest process with Health Consumers Queensland, you're able to nominate if you do need specific accommodations made, and that will be passed on to the service. And then if they don't make those accommodations, then, they're in trouble and you're allowed to complain. But, also there's, ways in which we can upskill, to upskill services themselves to understand what accessibility needs may need to be accommodated. And sometimes that means you'll need to go to another consumer representative who you're on a committee with and, basically say, hey, I'm uncomfortable with the way this is being run. Can we both go together to the convener of this committee and say, hey, we really need this changed or whatever. Some really emerging spaces are, as you said, brain injuries, all of that kind of, cognitive ability, level of education. Neurodiversity is a really big one that gets overlooked in these kinds of settings. It's a really big issue for me and something I advocate for quite strongly because I work with a lot of people with psychosocial disability, and it's really, really important that not only that consumer information pamphlets like, here's how you get a skin check, that needs to all be really appropriate for the community, but the language actually used on the committee and the resources that are given often can actually be adjusted to ensure that the consumers are equally able to engage. So yeah, that can take a little bit of time to feel confident asking for, but it is something that can happen over time. And we're seeing a really big shift in the way that these processes are run to be in a bit more of a positive and inclusive direction. Anything you want to jump in on that one, Rima, before I go to the PHN question?
I think the really important, am I muted still or you can hear me? I'm good. I think the really important thing here is, EJ, is to ask, because health staff wouldn't know what they don't know. So if for some things it would be really obvious and they would think about asking, but other times they may not, even as simple as there's a meeting that's happening between 8 to 9, your medication taking time is at 11 o'clock, or you need to do something where you can't be with everyone. You can organize to have that accommodated for. Everybody can take a tea break at that time, but they wouldn't know to do it if you didn't ask. So the important thing is, like I said, ask a question. So ask a question. Ask, can you accommodate for this? Maybe you couldn't turn up for a meeting. You can say, I would really like to give feedback. Can I do it in an email? Can I do it over the phone later on with the chair? And more often than not, people are really accommodating. Health staff are also navigating really interesting terrain and times. COVID's really thrown everything up in the air. So people are more responsive now in ways that they would have never thought of being. So I think it's had a really positive impact on consumer partnerships. And so I think there's a lot of opportunity to jump on there. So we've got 7 more minutes. There is a question about PHN, but I just wanted to check with everybody. Is there anything else related to the consumer journey? If there's a question around that, if not, then we'll take the PHN one, or we'll attempt to anyway. Jordan's got more background than I do. All good? Jordan.
Well, I actually do need a bit more clarification about what you need to know. If it's about actually engaging with PHNs, then it's a similar thing to a lot of hospitals and health services in that they'll have like an online form and you can kind of contact them, or you just go to their stakeholder and communications team will have an email address. You can email and say, hey, I really want to work with you guys. And then that usually leads to a bit of a follow-up conversation, because PHNs are actually fairly new in terms of consumer engagement. And so they don't actually have a lot of existing networks necessarily. They've only been around since 2015, which a lot of people can forget sometimes. They're really kind of in the early stages of engaging consumers. So they'll usually be incredibly excited that you want to get involved. In terms of the actual funding and all of that kind of stuff, I'm happy to have a conversation out of session about things like the commissioning cycle. I think it's really interesting, but I'm a huge nerd. So yeah, if you're also a huge nerd, please get in touch with me. I can put my email in the chat and I'll happily talk about the commissioning cycle with you. Yeah, does that
I think the question also was, she said the founding of PHNs. Maybe the thing I could say there is that, remember in last week's session, we talked about different buckets of money. So the PHN's bucket of money is federal government or Commonwealth. And so their jurisdiction is around pulling together all of the GPs, and this is not an area that I have a lot of knowledge in, so I'm not going to try to, flesh it out any more than that. But to say that the GP land and the public health system, what we hear and personally also experience is the disconnect between them is profound, and it's one of the spaces where I think it causes a lot of grief for us as health consumers when we're navigating our own health. I mean, as simply as my son having surgery, then being transferred to our GP, and then, the records are not even talking.
They're not allowed to talk to each other is something a lot of people don't know. Yeah.
It doesn't make sense, but go ahead, Jordan.
Yeah, on that as well, it's really important to remember that, PHNs also do more than just GPs. So they're actually your entire suite of community services. Anything that isn't run by Metro South Health or Metro North or Children's Health Queensland, it's run by the PHNs. So that includes your community mental health services. That's all of allied health basically in the community. That's your pharmacies. That's community nurses and community practice managers. So actually knowing, like if you've had a negative experience going to a community speech pathology appointment, or you're having troubles with some of the people that you've got an NDIS plan and you see an occupational therapist through that plan, that occupational therapist is probably linked into a PHN or is in some way administrated by a PHN. So actually knowing who to go to when things happen can be really, really important, and really quite tricky sometimes, because as Rima says, they don't really talk to each other very much. They service the same groups of people, but they don't necessarily work together to actually provide the same services. And that's really one of the most satisfying things about consumer work, is you get to be that person who's in both places, who talks to both teams, who understands where they're both heading and can actually say, hey, did you know that this service is actually currently working on this? And maybe we could you guys could have a chat and see how you can put your shared energies together. I cannot even estimate the number of times this has happened to me, where I've been on one committee that's been relevant to another, and they'll say, oh, we really want to get PHN representation, but we can't. And then I can say, yeah, you can. I've got their email. They're fine with this. You guys just go have a chat. And it can make it's definitely one of those whys that we were talking about earlier, is getting to be that point.
Yeah, that's really good that, it's they are an important stakeholder, and sometimes as consumers, you might be the one saying that, have you involved them? Because what we're talking about now is going to impact that gateway into health, which for most people is their GP, and for someone like myself who wasn't born here, and I don't understand, I didn't know until I studied it. Now I've studied it long enough. Another nerd, So I understand it a lot better. But in saying that, there are different circumstances that people come under. So someone who's an asylum seeker, so they don't even have sometimes the right to even access healthcare. And so they often fall through the cracks. So for all of these different variations, there's different ways to think about. And the public health system and the GP land, we call it, they all deal with it in slightly different ways. So we're like literally a minute away. Anything else? If there's no questions, and if there was something that someone learned today and they went, oh, that was like gold, I'm always going to remember that. Maybe someone can share that. I think I'm going to ask Alexander because he's got the biggest smile happening. Do you want to share a nugget that you kind of went, yeah, that was really awesome today? Oh no, Jelly's competing with her big smile also now.
Well, I think for me, it's honestly just everything. So even starting with consumer work in the primary health network with Headspace, and thinking of all the information I've gathered from all of these sessions, thinking how useful all this would have been all those years ago when I first started. So I'm grateful with all the knowledge that I've gotten from these sessions.
Awesome. Thank you. All right. Well, we're dead on 6:30. If someone else wants to share, we're going to linger for a little bit. Otherwise, have a wonderful, wonderful evening. You're all nerds because it's 5:30, 6:30 training, and you're wanting to learn instead of vegging out in front of Netflix. So good on you. Have dinner, have a glass of some kind of beverage. See you next week for our last session with Breanna. Breanna, you want to give a big wave? Breanna's going to be our presenter next week.
I look forward to seeing you guys all next week again.
There's Breanna. Good night, everyone.